Good morning, everyone, and welcome back.
Good
We're
morning.
thrilled.
Good
Good morning,
morning.
sir. Good morning, everybody. We're thrilled to bring you part two of our ongoing panel series on industry, academia, collaboration for effective implementation of AI strategies in healthcare. So, in our previous session, we explored how AI is reshaping diagnostics, public health, and clinical decision making, and the vital role that collaboration plays in making AI effective and ethical in real world settings. So, today we continue that conversation with a new set of panelists, panelists of distinguished leaders from healthcare, education, AI industry. So each bringing fresh insights and experiences to the table. So this evolving conversation reflects the complexity and opportunity of our times, and we hope it sparks ideas, partnerships, and action beyond this room. So I'm delighted to welcome everyone, and let me give a brief introduction about every panelist here. So delighted to welcome our panelists, esteemed panelists for the day. Firstly, Dr. Rajeev Gautam. Dr. Rajiv Gautam, president of HORIBA India and an IIT Roorkee alumnus with over 30 years of leadership experience across Cadila Pharma, Ranbaxy Laboratories, and Burma Pharma, to name a few. A strong proponent of local to global made in India, he has been instrumental in establishing HORIBA's manufacturing footprint in India while passionately driving technology, healthcare, and sustainability initiatives. And sir, please wait for our audience.
Yeah, thanks,
Yeah,
sir.
hi. Yes, and next up we have Dr. Sabine Kapasi, a healthcare professional and global health strategist who brings together unique expertise in medicine, finance, data science, and policy making, etc. So she served as UN strategy lead on the COVID-19 task force, guiding health responses across 197 countries and more, and played a key role in the Obamacare campaign as part of the core pricing strategy team. And she's also an IIT Roorkee trained gynecologist with further education at Wharton, MIT, NYU Stern. Dr. Kapasi has led or advised over 50 international programs with WHO and continues to shape healthcare financing, risk management, and policy worldwide. Currently, she heads Enera Consulting, mentoring startups in health tech and sustainability tech, and is a frequent guest lecturer at institutions like Harvard, INSEAD, and NUS. Beyond her personal achievements, she sits on advisory boards with global ministries of health and remains a strong advocate for equitable healthcare access and innovation. Ma'am, it's such an honor to have you here on this panel today.
Thank you so
And
much.
you're welcome.
I though haven't had the pleasure of being a Roorkee alumnus. I was at Manipal, nonetheless.
I am so
Oh,
sorry for
okay.
that.
No,
I,
that's okay.
I,
I'm sorry
I
for
was
that.
just
I
trying.
did.
I was just trying to remember, but anyway.
We
No,
too
no,
did proper research, and I'm sorry for that today.
no, of
Yeah, I'll
course
correct
not.
it.
That's okay. I would have loved to be though at some point.
Yeah,
Okay,
That's one thing
great.
I missed out being an IIT alumnus. Okay.
Well, that's great.
Okay,
Like I'm meeting a fellow alumni, then I'm also from Manipal.
Oh,
yes.
MIT,
oh,
right? We have a lot to chat about then.
Yeah, definitely.
Yeah.
yeah, yeah.
Thank you for taking it
Yeah.
sportively. Thank you for that. And next we have Dr. Govinda Roy, an associate professor of marketing at the International Management Institute, Kolkata, and a mentor with IIM Ahmedabad Center for Innovation, Incubation, and Entrepreneurship. With diverse experience across the corporate world, startups, and social initiatives, Dr. Roy brings deep expertise in telecom, IT, business consulting, market research, and entrepreneurship. So he has worked globally in areas like enterprise business solutions, program management, and telecom projects, giving a strong understanding of international business practices. So he's also a passionate mentor, having guided startups like CII in IIM Ahmedabad, Sankalp Forum, NEN, and IIM Calcutta. So Dr. Rai is also deeply committed to social causes, leading initiatives that provide education and resources to underprivileged students in rural India through Lakshya Foundation. We're so honored to have you here, sir.
Hi.
And yes. So next up we have our Mr. Aarsh Srivastava, our CEO and co-founder of Gravitas AI UK, and a visionary leader in the field of intelligence and business strategy. So Aarsh has co-founded Gravitas AI with the mission to transform the way organizations think, strategize, and operate with AI. And today, the company stands as a pioneer in building AI-driven, customer-centric solutions across industry verticals. AI and ML strategist and an AI product expert, Ash has led groundbreaking projects, including the world's first healthcare chatbot, and continues to shape how AI is applied in healthcare, education, and enterprise operations. So he brings a unique blend of technical expertise and business acumen. So beyond the corporate world, Arsh is an industry advisor and adjunct faculty at Manipal Institute of Technology. He's just not only an alumni, but he's also an industry advisor and adjunct faculty there. And he also mentors students at India's top MBA institutions, preparing the next generation of leaders. He's also an ethical AI advocate, emphasizing human-centric design, trust, and transparency in AI adoption. A sought after global speaker, Arsh has addressed audiences at multiple international forums, sharing his vision of how AI can enable business to scale ethically, efficiently, and sustainably. So it's such a great honor to have you all here and to continue this same topic for the next session of part two. Very good morning and welcome to you all.
Good
So I
Thank you.
morning.
think, yeah, I
Thank,
think with that, let's
thank,
get started. Yes.
thanks, Gravitas, thanks, Gravitas, do this panel discussion. It's a very apt topic, and it's the buzzword today, AI and generative AI. So I think that's a very apt topic, and hope everybody we will be able to contribute, and our viewers will be able to get benefited out of it.
Yeah, can't agree more. Looking forward to the
Okay.
session with all. Yeah.
Yes, yes.
Yeah, sure. Go
Thank you
ahead.
so much for saying that. So, let's get started with today's session. To start with the big picture, how are global frameworks and local innovation co evolving, and how education can become a key driver of this transformation? So, I would like to start the first question with Dr. Sabine. Doctor, how is AI influencing public health policies and disease surveillance globally? Can you share this?
See, I think you have to. Am I audible first of all?
Yes,
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 they are
yes.
right. Okay, perfect.
Yeah.
So, see, the point is that policy is something that always follows innovation, right? Um, Look at it anywhere in the world, be it trade policies in the 1800s or industrial policies in the 90s, in the 1900s, and what we have today in terms of data privacy and security policy. Innovation comes first, and policy is just a way to shape innovation into a formidable outcome. So, when it comes to I think that we are still in the process of the industry evolving and coming unto itself with right use cases. Similar to what happened a few years ago with blockchain, where some use cases did survive and others were then highly regulated and didn't really make it, like NFT and others, which didn't really settle into strong use cases. So, but of course, AI has been around since 1960s, even as chatbots that we know it. If I'm not mistaken, Joseph Salisa was one of the first ones out there. And we have been exploring use cases of um, AI for now at least 70 odd years. What is new, though, today is the access to data. And I think that is where policy frameworks are bringing in a lot of inputs where how do we use data to frame some of these discussions, how do we use data to make some of these AI solutions, and what are the data sets that we can pull in, what are the kind of things like the black box effect that we have to be careful about, or the hallucination effect that we have to be careful about when you're looking at LLMs. That is where policy discussions are coming into play as a whole. Now, coming to public policy as such, when it comes to healthcare, things haven't changed a lot yet because the industry is just evolving. So, when the industry starts adoption of, say, agentic systems for CDSS, that is clinical decision support systems, where we actually start changing treatment and care protocols which are more AI guided, or we start using AI for behavioral change in patients, which is also happening with solutions which are specific to patient behavior, like, for example, Twin Health and others, which are focused on the life cycle of the patient as a whole. So now the industry is maturing slowly, and the discussions within the policy framework of how it's going to affect both the patient and the provider side is just about starting. But I believe at the moment, the largest interaction of AI systems are coming up with use cases in B2B space, not yet as much in the D2C aspect. So the policy is going to take some more time to actually mature for that effect.
Great, great. Thank you so much for giving more information during your while making your points. I'm glad for that. And with that, I would like to get the view of Dr. Rajiv here. Sir, from your global perspective at Hariba, how can India scale made in India AI-enabled medical devices to become a global healthcare innovation hub?
Thanks. Thanks for asking a pertinent question. Can you hear me? Yeah.
Yes,
Okay,
yes,
because I am outside home.
you're
Uh,
very clear.
see what what is happening in this world is that so many academics are working on this subject AI. When we talk to a lot of IITs and triple IITs and other institutes, uh, every it looks like that everybody is working on AI. Okay, so from a HORIBA perspective, when we go and try to search and try to find out something which is usable for the industry, honestly speaking, there is hardly anything. There is a repetitive things they are doing, and honestly they are doing the same project which his or her guide has done it, and that they just picked up that topic, and we are continuing on that, which has hardly any relevance to the industry. So from at Hariba we think that we give the problem, whatever we face it, the problem from a customer centric or industry centric to all the academician, all the teams and everything, and they work and we work to the hand and gloves together to work on the problem to find out the solution. So the trend what is going on from academics to industry has to reverse from industry to academics. Otherwise, there will be not notable contribution. There are the huge amount of work, but it is not being used by the industry or the for the public situation. Policies, maybe policy may be different. I'm just talking about healthcare. I'm only talking about from HORIBA perspective. Thanks.
Okay. So, hearing from both of you, I think education plays a powerful role in building the capabilities needed to support that kind of growth and innovation that we are foreseeing. So, with that, I think let's hear it from Professor Roy. Sir, how we are aware about the Gravitas AI and IMI working collaboratively to achieve this. So we would like to hear it off from you to share this with our viewers. So how Gravitas AI and IMI tie-up can help in proposed certification courses and digitalization in healthcare.
Okay, very good. So I'm not from the healthcare industry, right? Most of my experience in IT and telecom industry, but here at this present role, I'm representing academia, right?
Yes,
So
yes.
we, from the last few months, we are in touch with Aarsh in designing the course outline. And when now I'm from the marketing side, right? Bit of IT background. So when we are designing any marketing, finance, operation, analytics, right, we always keep in mind how the course can be relevant for the industry, right? Without industry, is there is no meaning, right, to have this kind of. So there, gravitas comes in a big plays a big role. Just we sit together and optimize the content. Let's take an example of marketing sites. So when we in this particular certification, it's a this smaller time with few models how we can introduce marketing. So when you start marketing, for example, right? So it starts with the basic, right? What is 4P of marketing? And additionally, since a healthcare services, so we should not restrict to 4P, rather we are going by the 7P and special introduction of the segmentation, targeting, positioning because the service industry. Now that without digitization, without automation, the course cannot be complete. Now again, we are in touch with the gravitas, how we can take the web.to application into it, right? So we call that digital marketing, right? So those specs and the automation of marketing functions, so that also become a part of that our coursework. And finally, we are into the web.3 as the main course is the AI application in marketing. We also included that portion in our courses so that it starts from the basics of marketing to advanced of application of marketing using AI. So it is a case example I mentioned with respect to the marketing. Same is applied for the other functional areas, be it finance, be it operation, because these are the very core function of any healthcare services. So with Gravitas experience, right, they have lots many use cases, and with IMI Kolkata, with our academic rigor, pedagogy, using the various case studies, so I feel that our course would be really industry ready, backed up by that Gravitas domain experience and as well as our academic exposure and expertise in this area.
Great, that's very reassuring. So, having touched on global opportunities, so let's now address the regulatory and ethical responsibilities because the rapid innovation often raises equally rapid concerns, right? So, let's think about the policymakers, technologists, and institutions, how we all can align better on this front. So, I would like to hear it from Dr. Rajiv again. So, what ethical or regulatory challenges do you foresee with the rapid integration of AI in clinical decision making, and how do you think should industry and academia collaborate to address them?
Uh, I think it is about the data. Okay, so data is flowing everywhere, and whether it academics or industry, ultimately it is a data crunching and it is data analytics. The issue is about the ethical and and maybe regulatory situation. Okay, we today it is free flow. It's going everywhere. Nobody understand who is saying what and who is controlling what. And as Dr. Sabine says that okay, it is before the innovations of that the policies comes. I think we need to decide about sometime like say, like GDPR of UK. There is a regulation there, and I think India has to may not follow 100% because our situation may be different. So we can take up similar type of a situation from that side. So we need some regulatory framework that exactly that from an ethical perspective and also from a regulatory perspective that we need to define a rule and basically boundaries. It is very difficult to put otherwise the innovation will cannot come if it will become too tight and regulatory. So but we have to create the boundary and let everybody play within the boundary. Otherwise it's a free fall everybody and it go in a different directions. uh, I'm afraid that it may go into wrong hands and then it will technology of AI will be misused than better than the use. Okay,
Great.
thank you.
Yes. Thank you for sharing that. Mr. Arsh, building on the point about regulatory challenges, in fact, from the AI industry perspective, reassuring Dr. Rajiv, let's get your views on how is the AI industry preparing for compliance with healthcare laws like the international HIPAA or India's DISHA? Are current regulations AI ready?
Well, if I have to answer in a word, no. Then we are preparing. And to answer this question, I'll take a leaf out of like the co-panelists' answers. So, with Dr. Sabine starting with the policies and where we are, and Dr. Govind mentioning about the wide scope and the level of operations which happens in the healthcare industry, and mentioned by Dr. So about the uniqueness, how was what is the need of the uniqueness of the type of solutioning which is required, rather than like just keep banging on the similar side, a similar type of like use cases which have been done everywhere. So the scope is quite large. And given that the healthcare industry is like somewhere structured, somewhere unstructured, somewhere semi-structured, there's a lot of like scope of also regulating it first, because say, if we have to develop a regulatory framework for AI, we have to first sort out the data framework and the data related challenges. As rightly mentioned by my co-panelist about the GDPR, which is a very key regulation in the EU for managing data and managing the rights of the people who are involved in users of data, and also like the end consumers. So that kind of framework is very much required in India, and we've got DPDP coming up like, as a very good data framework. So that will set up the base of this whole regulation, which is supposed to be for AI regulation in healthcare industry. Having said that, the EU has also passed a regulation on how to use AI ethically, and I've been involved in this industry for the last 1 decade. Launched world's first healthcare chatbot 10 years back. Then there was nothing. We had just GDPR launched, and we were like totally up and down on the floor, like trying to understand how it will impact and what should we should leave, what we should capture in the chatbots or the end systems which we are building. Because if we are to build that along with the regulations which just were introduced, we had to undergo certifications ourselves to understand like what is there, because it was totally new concept. And since then there's been a lot of change. Technology has changed leaps and bounds, as I as we have like seen now LLMs coming into picture. Everyone is using GPT across the board for different kind of things. Back then it was all about structuring intents and slots and trying to get a meaningful answer from the bots. And like 5 years before, like we were working on a proof of concept for getting data out of here, the constructed PDF. So these I'm just trying to point out the different type of use cases which are there, and how we have to regulate it is that first step is to regulate the data. Once we have the data regulation sorted, the base is totally sorted, and after that we have to look into the user centric journeys, and like how we are deriving the process automation or contextualization, or the kind of like AI implementation which we want to do, including data science or machine learning algorithms, and what is the impact of that on the end user. So once we have like refined all of that, that will be the base for like having a basic level of AI regulatory framework, which we are far away from at the moment. But definitely with the steps which the governments are taking across different countries, maybe a couple of years, 3 years, we should be there in the place with the right kind of regulations. That is what I'm hoping. I was recently on a panel with NABH where they are discussing like how things should change for hospital administration as well, in terms of managing data, etc., in the light of massive introduction of AI now, both for the end users and like the hospital staff as well. So yeah, things are moving ahead. It will take a bit of time, but until then, it's the responsibility of the people like us, suppliers or the companies or technology developers and the people who are implementing, to handle it carefully and wait for the right kind of regulations.
Great, that's it's a clear path. Thanks for giving the reassuring points here, Arsh. So now let's shift to how these technologies are actually reaching the patient, because we're talking about healthcare here, and they are the beneficiaries in the end. So through diagnostics and engagement and personalization, let's analyze how these technologies are actually reaching the patient. But I would like to hear this from Dr. Govind Rai here. Sir, you already told about not having a close association with healthcare, but you have more understanding about that, and you've also explained to my earlier question. So now, sir, tell me this: how can AI be used to better understand and influence healthcare consumer behavior? What's your view on that?
Yeah. So again, I'm not from the healthcare industry, but I'm a user of that services, right?
Yes,
So I can
yes,
tell from the service, but the user perspective, right? So
definitely.
now I like to mention my experience. It was last year around September. So I was having certain issues. We call that certain parodotomy. Basically, the parotid gland, there is a tumor on that. So I like to get it operated. So I was planning to get it operated outside, right? So better I thought to get it done from Chennai. So I'm not mentioning any brand name over here, right? So what happens now? I booked online because nowadays it's all tech savvy. No need to fly to Chennai and get it there. The initial consultation I can do it online. Now here comes the AI, right? So when I registered over there, I got that the dashboard where I can talk to them. And before just meeting the doctor, they put me through a the chatbot. That is the chatbot. So this is like again in medical terms, right? So basically they are taking certain history of patient, right? So I was going through that. Again, it's nice because I am using that area for other purpose, academic chatbot, not the healthcare chatbot. They started asking me question, but again privacy become a concern over there. So I was giving through question and they are answering question, giving through different options. What I found it really, right? Meaning that if I don't have any kind of reservation about sharing my data, otherwise really it's savings time for patient, right? It is savings time for that healthcare service provider to capture the basic information needed for the final consultation with the doctor, right? So that's one example that the AI could be used for reaching out to the patient, right, to capturing their story. Now, in terms of privacy and other things, definitely that's a concern. Okay, so that's really improved the engagement, but this is not for the all mass public. Those who are going through that certain process, who are tech savvy, maybe they should be able to get engaged with that tools and techniques. So AI and ML implementation in customer engagement and outreach should be, I think, more ready with aligned with that regulation at the same time, more penetrative powers. Right now comes to the next one, like how that a digital AI ML could be used for the tracking customer footprint, digital footprints. Right. So I am attached with this industry for two plus almost 2 decades. So I started my journey web.1, that time only one pages, and that's no dynamic or all static HTML pages. Now it's a interactive web.3. So what that companies can use or hospital service provider can use, they can use the intelligence services. When someone go to the website, browse certain pages, see the doctor's profiles, right? Companies can able to track them. So it is my utter surprise. So I was browsing through the last year. I was browsing through certain profile. I got a call from that hospital, sir. You are going through certain profiles and all this, right? Would you be interested to get more you know kind of data or more kind of information so that I can help you? You see that second level of engagement, that is using the AI. So digital footprint analysis. Third one is that nowadays we are using online reviews, electronics word of mouth, right? So again, that most of the platform who are giving that online consultation without naming certain platforms, so they try to showcase their reviews of doctor. Like these are the set of reviews so that customer can read and go through that one. Now, to some extent, I feel those are biased. Customer also knows. So what are the independent platform? Independent platform, what I believe is a Google My Reviews, right? I can independently go there. I can put good, bad, and average reviews. So AI can take the reviews from all these independent platform, do the sentiment analysis, see the pain point over there, and they can make good suggestion for the hospital service provider, right? So I did same thing because I also going through the Googles. I go to the hospital website, but I'm not happy with the reviews over there. I go to the GMB profiles. I see the feedbacks over there, right? And I got operated. I am now having without any issue for the last 1 year. So AI can be used definitely with the more footprint analysis. It could be we can provide the customized engagement through chatbot analysis. It could be reach the customer through very personalized messages. So it's really very much effective tool for customer engagement and outreach.
Thank you. Thanks for sharing that honest review, sir. I think the next question goes to Mr. Arsh, undoubtedly. Mr. Arsh, from a tech provider's perspective, how can AI companies address this and ensure transparency and explainability in clinical decision making tools?
I think like we have to get to the basics. One, implementation level. Second, like the user level, and third, what's happening actually in the global scenario. We have to look at that. So basically, when you're talking about implementation level, we should use like more transparent models, interpretable models. We should be like focusing towards a bit more about explainable AI and the concepts of it, so that we are implementing things in a way that the whole solutionizing is focusing towards transparency. The transparency depends on like what kind of users we are looking at, and what kind of data we are implementing, and where we want to explain it to. So that all depends. But yeah, we should be like be more focused on that area, so that we are not hiding concepts and hiding things from the end users. That is one thing. So apart from that, I think the user feedback and the patient feedback, or maybe the hospital's people feedback, basically all the stakeholders who are involved in the or involved or are getting affected by the solution, they should be taken into consideration, and there should be continuous feedback loops, because if you're implementing an A solution, it can be like basic chatbots are okay. Like if you're doing some process automation, that's fine. But the larger implementations, like which are things which are impacting more clinical decision making, so we should have all stakeholder-based reviews and feedback from management systems, so that there's a continuous feedback loop going on. Because you can't, even if the strongest LLMs, you can't develop solutions overnight. Because you can connect it to LLMs, you can get decision, you can recommendation, etc. But if you start connecting with the end user, it's very different, because ultimately AI, the word AI is artificial intelligence. We're trying to mimic the human intelligence, and for mimicking human intelligence, we need to like reflect on how we think or how we respond to things. So that is which is very important, and that's why like this has to be regular feedback sessions, whether it's like your telephonic interviews, focus group discussions. The basic techniques of like research becomes very important in developing a good AI solution which is explainable and transparent. Apart from that, I think the bias and fit these and the fairness audits, these are very much required as well, because the development teams, which even if they're doing good level of research, they'll have their own bias towards developing a solution, because we all come with like it's very human. We come with our own like thought processes, life experiences, experience of implementing previous projects, etc. So we have to also like think a bit outside of the development team, and include more subject matter experts into the solution development. So that will also bring more transparency and explainability. I think these are the key pointers, like high level pointers. It has a vast subject, we can discuss definitely a lot more. But if we are focusing on these key areas, definitely there will be transparency and explainability in the tools which we are developing.
Thank you. Thanks for that reassuring words. Next, I would like to hear it from Dr. Kapasi. Ma'am, how can international organizations like WHO support equitable access to AI-driven health technologies?
Um, Thank you for the question. I think one of the first things that you have to keep in mind here is that first, let's understand what are we talking about when we are looking at health technology, which is AI driven, right? Is it a customer facing chatbot? Technically, no, because it has applications across several industries. That's not healthcare specific. It's more specific to consumer behavior. What we are talking about is technologies like, for example, what Cure.ai is building, which is image analysis and looking at prescribable healthcare outcomes through it. Or, as we were talking about earlier, a clinical decision support system, which basically draws decisions and forms a direct, you know, direct response in patient behavior and patient outcome, or maybe a combination of hardware and software solutions where you have, an Apple Watch which is doing both sensor capture as well as prediction of patient behavior, and hence going forward through that. So these are the three broader categories that health technology can be looked at, first of all. Now, the point is, we spoke earlier about how regulation follows technology. But I think one of the things we also need to keep in mind is need to outcome analysis. What is the need in a certain criteria versus what is the outcome? For example, there is a chatbot, I think it's called Marvin, which is used in HIV analytics globally. Now, HIV is again a very po- pocketed population. People are very, very, um, it's a area where there's a lot of taboo even in access to healthcare, and where Marvin has created huge pockets of access. So there are certain problems in healthcare, right? There is the problem of access, affordability, accuracy, and trust. Now, these are the four problems which, in certain use cases, some of these solutions are solving extremely well. So, in the process of, as I was saying, HIV diagnosis, there was this chatbot that was deployed. There weren't enough frontline health workers who can actually go home to home and do these level of education, because there was a huge social bias to it. So, such solutions, when designed for a specific problem, have an amazing impact to an outcome, and those kind of things can be very well supported by international organizations, not just WHO, but also organizations like the IMF, the plethora of development banks that we have, and development funds like the BII and the NDB. But the point is that we have to first do the need analysis very, very specifically, because technology is an answer, a solution to a problem, should not be looked at in a standalone silo.
Great. Thank you. So with that, I think let's hear it from Dr. Rajiv Gautam. Sir, we have heard from other panelists. So now you tell me from the industry perspective, how is AI transforming diagnostic technologies in India? I would like to know, especially in resource-constrained settings, because we I just heard from Dr. Sabine on the case. So you tell me, what are the challenges and opportunities in integrating AI with medical devices?
Thank you, Chitra. I think it's a right question from a perspective of diagnostics and AI. Let me give you one example, and let me give example of in vitro diagnostics, pathological laboratories in this country. Okay, there are close to 100,000 labs in this country. You find it in a hospitals, you find it in a near neighborhood, at our city. 100,000, 100,000. Okay, but you will be surprised to know only 50% of these laboratories have the pathologist, and they are run by the lab technician. So lab technician is running it, processing it, and then he will have a contract with some pathologist to sign it, and then it will give it to the patient. So honestly speaking, pathologist is not putting his brain there, not looking into the process. And it is just as a process-driven reports. It is not reviewed by the pathologist. Now coming to HORIBA, uh, there is a hematology. Hematology means that you see the blood and the cells, blood cells, and you define certain type of RBC, WBC, all sorts of the things. We are in the hematology business, and we have a lot of equipments. Now we have a equipment which is the digital morphology. Means you put a sample and put a camera, and camera will take the pictures, and there is a library behind it in the cloud, and then it gives the results which can be transport from any part of the country to the pathologist, and pathologist view it and then give it the results. For example, in a Himachal, in a mountain area, there is no accessibility for the pathologist. So we have these machines in the very remote area of Himachal. There is only one technician We just put the blood sample into that, take a picture comes to Delhi and the pathologist sitting there, and then pathologist give the results and on his opinion, and then it is being reported. So it has become totally, Himachal has been totally connected, whether pathologist or not. So that is a beautiful use of AI in diagnostic, because ultimately these machines. Second, I can say about the similar thing is going to happen slowly and later on, about the real radiology, reporting the reports of X-rays or other things and everything. Somebody can take and somebody can read it, somebody can report it somewhere else. So but it will not take away the role of pathologist or radiologist. So they will be still there, because for the somebody need to read the results as well. So, but it will be much easier for the healthcare system. It is for much accessible for those type of patients, those type of hospital, those type of population which were not, which was not for them, which are not available now. So that's the is a huge advantage of AI for the patients, for patient services. Thank you.
May I add something to what Dr. Rajeev said, if
Yes.
that's okay?
Please.
So, I mean, as he mentioned, there are about 100,000 labs in the country. Do you know the number of pathologists, MD pathologists in the country?
Please
The
let us know.
actual number of MD pathologists in India today, at least according to the best of estimates, is 5,500 for a
Correct.
100,000 labs, right?
Yeah.
And if that is the case, I mean, that is where we do need innovation, where reading of reports through large scale data comparison models can be, and it doesn't have to be an LLM here because it's not a large language model, even it's actually a quantitative model that you're building. So, here, if you are looking at a competitive model for just pathological analytics, and the accuracy can be comparatively measured and has a class 2 validation through either a USFDA, MHRA, or even CDSCO. At that point, we would be able to combat this problem in a much better way, because then a phlebotomist and a lab can be far more functional and accurate in its outcomes, and the trust within the system can be built far better. So, such use cases where we know that actual human resource is a massive bottleneck, that is where using AI solutions to combat that, and then of course add to the accuracy of care delivery, is going to be crucial going forward. I mean, that is some similar problems that some of these solutions like QR are solving for radiology. So I think similar needs are there in every specialty. So surgical solutions cannot be changed easily by AI, right? Because you still need a surgeon with both his hands. But places where there is analytics, especially in solutions like endocrinology, where the both the vertical data and the horizontal data needs to be massive for an exclusionary diagnosis. For such areas of specialities, you really do need large scale solutions which can help. So if you look at, though there are 5,500 MD pathologists, endocrinologists technically are only about 1,500, because it wasn't even a degree for a long time ago. So yeah.
Thank you. Thanks
No,
for that
no,
points, Dr. Sabine.
no, very
Yes.
well put in the perspective. That's why I'm saying that. Okay, so technology can overcome, because overnight we cannot make our pathologies or other things, but we have to make the technology use by, we have to make maximum use of this talent whatever we have for the better patient care.
Great. In fact,
Yeah.
this particular topic we are discussing and bringing in more insightful information. Thanks to Dr. Sabine. I in fact would like to know more points from other two panelists also, Mr. Arsh and Dr. Roy. So, would you like to add any points on this? In fact, Dr. Roy, from the patient perspective, because initially when I started off asking about this particular question, so he mentioned about wanting to give information from the perspective of the user. So I think, having heard from the other panelists, Dr. Rai, please share your views on this.
Yeah, that's rightly pointed out, our co-panelist, right? So basically, challenges are there because we are not that way, know the technology and the what things really working behind that pathology reports over there. But the accessibility, as Dr. Gautam is mentioning, someone sitting at a remote place and getting that report delivered, right? At right moment of time, so that would be really good for customer engagement as far as customer engagement are concerned. And we as a customer, no, we just as a general customer, we think that whether my report should be tested from a nearby lab or reputed lab. So I'm in Kolkata, there are hundreds of labs are around, right? So when we're looking for any kind of authentic reports, right, so we need to go to the best in class because my report would be genuine. And here, basically, hindrance may be there from the customer perspective. Like if you tell that it is reviewed and it is be diagnosed or be detected with the help of AI, right? Then again, it comes that because one is a human intervention, like pathologists see that, and as and the AI expedite that process. So that is one thing is the customer, awareness is very important over here. Like, one is the quickly I can get the report. Second is that yes, it has been expedited by the AI process, further reviewed by pathologist. So if you can communicate these things, right, the end patient, right, the consumer, that would be really good.
Yeah, I think
May
we'll
I
just
just
sorry, Dr. Sabine, go on,
uh,
please.
just one small point that even today, if you read your reports, most of the analytics, so there are some primary data collection through machines, and then there are secondary analytics where it already says that these are AI reviewed. It's already happening at the moment.
Mhm.
There is a sign and stamp of a pathologist, but this is already happening, and the consumers are very happy with it because it comes to
Yes,
your
definitely.
WhatsApp within 4 hours of sample
Yes.
collection. So I think that we generally underestimate the intellect of a consumer at times. We should give more than consumer patients a little more credit because in healthcare, at least, we don't look at consumers, we look at patients. So I think that is one small point of note. Yeah.
Great. Yeah, Mr. Ash,
Similar,
please.
yeah, similar points. Like I was just trying to, like, we have to you put that trust factor in the patient, and as we explaining it critically, like, okay, this is being examined by AI, but definitely being further examined by the pathologist. So that is something which becomes the key trust factor, and like also patients know that okay, they're telling us like what is happening with our data. It's not like somewhere in the black hole, like how it's happening, because ultimately, healthcare is not only about the subject matter and the expertise which is it has. Also there's a lot of things driven through your mental state for the patients, and that is where like effective healthcare comes into picture. So like the more they're aware about things, how things are happening, the more they will be trusted. And also you should be also like the organizations which are using these technologies, they should all be boasting about like how effectively they have built up these solutions, so that like people are more aware about this, and like the more that spreads, the better it is for the whole country.
Great. Actually, I wanted to know about how these technologies, whether are these actually reaching the patient. Now, I think these points spotlights tech translating into trust. Thank you so much for all your views on this. So, I think considering the time constraint, so I have one last question. Having discussed all the strategies and gaining so much insights on the topic, I would like to conclude this session with one important questions on this topic. And I would like to conclude that with Mr. Arsh. Mr. Arsh, you have launched world's first AI virtual assistant in healthcare, especially, and you're closely associated with many institutions as a adjunct faculty, industry advisor for AI, etc. I would appreciate your views based on your collective industry academia experience, right? So my question to you would be, what kind of curriculum or certification modules do you think are critical to prepare students for AI-led healthcare transformations?
You are muted.
So thank you.
No.
So if you are talking about students specifically, we have to stick to the basics. And like I think, in my understanding, we should start from the very base of the mathematics, which is the stats. and from there on start building upon it. So there's definitely one area which we need to cover in terms of the basic mathematics which is there for AI, because then they start understanding more about how it is being done, and then the modeling and other aspects should come into picture. Because straight away if you're starting with like training sessions on regressions or discriminant analysis, some sort of techniques like that, or machine learning, then it will they'll be okay to grasp that, because like we've got like more advanced tools with a lot of information. But if the base is very strong, so I think like in the foundational course I always like to include basic stats to start with, and how things are computed from there. Apart from that, I think process understanding, the domain understanding is very much important. So even if they're implementing technology, or like I'm trying to understand technology, the understanding of the domain, the vastness of the domain, I'll say, because healthcare is a very broad subject, well divided into multiple specialties, subspecialties, different kind of users are there. So they need to understand the landscape, the domain. So that is also very important in terms of like including that should be a part of the course curriculum, definitely. Apart from that, like understanding about the devices, diagnostics, and the other procedures which are very important. So that is something which should be included. I'll also say like we should also be focusing a bit on robotic process automation side of things, so that they understand the applicability of that, and how they can include those things. How can start thinking about solution building. So related to that, then will be the product development schooling, so that people are able to understand how to develop effective and efficient products using all these technology which they've been taught. And then a part of like understanding should be built differently about the leadership, and how leadership thinks in healthcare and different spaces, not only specific to a particular sector or a particular geography, but in different geographies how things are built up. So that should be essential part in my understanding. And the most important, the core aspect, is the ethics and the explainability. So how to like build up solutions which are more ethical and compliant, regulatory compliant, and also at the same time secure and scalable, so that it can be used well at different scales, and for the right kind of audiences. Plus, they should be trained definitely into a lot of market research, and how to do that effectively, because ultimately the solutioning will be governed through the right kind of market research and understanding of data. So I think these six and core concepts are very much important, including the operations understanding, in my understanding. But I'll open this for other panelists also to reflect on that.
Definitely, because it's very important to prepare the next generation of professionals and decision makers, to thrive in this AI-driven healthcare future. And I would definitely invite other panelists to give a concise points on this particular topic. Dr. Rajiv.
I think I will largely agree with Arsh, because not my subject. I will not take much on note on that. But I largely accept the points what Arsh is saying is talking sense.
Thank you, thank you. Dr. Sabine, please share your views on
Um,
the.
I think that, of course, we need to build a workforce which is AI trained, a healthcare workforce which is AI trained. So, speaking a very specific language, which is not actually a language of tech building, but more tech application, and how can you play around with that within the AI tooling space is going to be very interesting. And I think that that is going to bring about a lot of change in the way the one of the core problems that we have is resource constraint, as in total number of doctors, nurses, otherwise is what we can expand upon. And second is also the quality of caregiving. So if you are basically treating about 100 patients a day, there are bound to be medical errors. One of the massive problems that we have faced is and which we don't even talk about, is so big that if we start talking about it, it's going to be a very depressing state for all of us, is the problems of medical errors or rather decision errors in clinical decision making. And that is something which, if we teach taking technological help, not just AI but across several other technologies also, to the current crop of healthcare professionals, and how they can expand their reach upon, if we are able to do that effectively, then that is one problem that we can at least start to solve, to certain degrees. I think those two aspects are going to be very, very important. One is which problem we are solving, especially in terms of accuracy in decision making. And the second one is, of course, training professionals more on applications versus the tech side, where they can actually shine and give inputs from an industry perspective.
Great, thanks for the value addition. And lastly, from the academician, Professor Rai, please share your views.
Thank you. Actually, I was reviewing that whole course content of our this course, right, with Arts and our team. Basically, our team from the different domain like marketing, finance, then analytics, right. We always see, as Mr. Harsh was telling, that starts with the basic understanding of best stats, and then going into that the basic understanding of the, we should not call consumer, rather the patient behavior, right. So we need to understand that. So building that concept again, also that the financial aspects, right, auditing and all this. So as a student of that particular certification program, that you should have all these views, not only the technical part, marketing part, finance part, and that would help you ideal, because you may be in the industry, you may be working in certain particular domain, maybe in the patient care department, but you need to have a holistic view of this. So
No,
our
I
course,
completely. I would like to add that we also need to teach HR statistics and all, and sorry, HR taxation and a lot of
yeah,
other things
yes,
also
there,
in
it's
insurance.
there, it's
So,
there.
because healthcare professionals essentially are going to be business owners in a small
Yeah.
and big way, and we need to train them accordingly. So much
Yes,
for
thank you
adding
for
that.
pointing this. Yeah, we also that the accounting, but again, it should not be too much heavy accounting, because number of sessions are, in terms of scope. Even the marketing also, I cannot give you the whole lot of things over there. It's a very capsule based, but covering key aspects, right? So again, for HR, as you mentioning, so we'll have a look there, Arch, right? And also you'll see this, because these are
I
the
think
other.
it was a deja vu moment because you remember, Doctor, in the last call on Tuesday, we were discussing about like how
Yeah.
to contain the financial bits.
Even the
Thank
Yes.
you.
insurance part, we need to teach doctors about insurance as well, a very
Yeah.
growing industry where
Hmm.
very little understanding interaction is. And I think one of the things is, there is this dialogue in Three Idiots, I believe, saying कि सिखा तो आप मुझसे बेहतर लेते हैं, मैं तो ये सिखाने आया था कि सिखाते कैसे हैं. So I think it's exactly that you teach people how they can learn about certain things, because medical school will never equip you for that. At least at the moment it's not. When I was there a long time ago. So I think that that is one gap that really does need to be solved.
Sure.
Thank you. Thank you for sharing all
That's why
this
it's important to
insight.
hear from the industry people to get
Definitely,
better information.
that is why we are conducting such panels and doing a series of panel discussions, because to get cross-functional people's perspective. Thank you so much to all our panelists for your time and for sharing such thoughtful and forward-looking perspectives. Part two of this discussion has added meaningful layers to the broader conversation we began, highlighting not just the potential of AI, but the pathways to make it work in practical, scalable, and patient centric ways. So, we've heard how ethical frameworks, infrastructure challenges, behavioral insights, um, and academic collaboration are all critical pieces of this puzzle, and how industry, hospitals, and educators must continue to work together. So let's continue to collaborate, experiment, and lead responsibly. Thank you once again, everybody, and we look forward to continuing this dialogue in future forums also. And viewers, we will come back with another session soon, so stay tuned and have a good day. Thanks a lot, everyone.
Thank you.
Thank you so
Thank you,
Thank,
my
much.
co-panelists.
Thank you,
thank you,
everyone.
So much,
Thank you,
Thank
everyone.
Chitra,
you.
for
Thank you.
managing the last 1 hour very well. Thank you, Chitra.
Thank you so
And
much.
thanks
It's a
Thank,
all,
pleasure.
thanks to all my co-panelists. We are
thank you.
more knowledgeable now. Okay, thank you,
Thanks,
Thank
definitely. And Dr. Rajiv,
thank
Dr.
thank
Sabine,
you,
I'll
bye,
connect
you.
with you.
Yeah.
thank you,
Yeah.
bye bye.
Okay.
Thanks a
Bye
lot,
bye.
everybody.
Thank you. Bye bye.